It gives me immense pleasure and happiness to invite my friend, Mrs. Manjula, to this platform and to share her accomplishments with all of you before handing over the session. Mrs. Manjula M. has been working as a Chief Nutritionist Assistant Coordinator for New Jersey WIC Program for the past 16 years. WIC is run by the US government to provide supplemental foods, healthcare referrals, and nutrition in breastfeeding and non-breastfeeding postpartum women and to infants and children up to the age of 5 years who are found to be at the nutritional risk. In her current role, she monitors the WIC program operations and is responsible for supervising the nutritionists, providing in-service training and counseling on maternal, infant, and child nutrition. Mrs. Manjula also acts as the preceptor for inspirational dietetic interns and the Kandam Country DTR interns every semester. She is an alumnus of the erstwhile Department of Home Science, Sri Sathya Sai Institute of Higher Learning. She completed her bachelor's and master's from Sri Sathya Sai Institute of Higher Learning and obtained her MS degree from University of Maine. Before joining WIC, she worked as a dietitian consultant at Inspira Medical Center and as a nutritional consultant at Amrita Diabetic Center. She has published a significant number of papers in reputed journals and newsletters such as Rutgers University newsletters. Mrs. Manjula will be speaking to us on the topic Battling Food Insecurity in the Pandemic and Role of Safety Net Programs. Over to you, Manjula. Thank you.
Sairam, everyone. Thank you for having me today. I consider this an immense privilege to be able to present in this department. And I hope the food insecurity issue, you would learn some new information, because this is, as Jaya has mentioned, this is very prevalent in the current situation. And not only during the crisis, but hopefully we would try to address this issue in the future as well. Sairam again, and I hope you would learn something new in this presentation.
I want to begin this webinar by thanking you all for having me as a presenter at this conference. And my special thanks to Srividya Didi and Sri Jaya for thinking about me and inviting me to present for the Food and Nutrition Department. Usually when we think about food insecurity or hunger, first thing that comes to our mind is something like an underdeveloped country or a developed country like India or Nepal. We would never imagine a developed country like US would have insecure or someone in Europe who can experience hunger. In today's presentation, I am going to talk about food insecurity and how our government had developed safety net programs as early as 1970s to address this issue. Throughout this presentation, you will hear a few acronyms that are repeated quite often. So USDA would mean United States Department of Agriculture. WIC program is Women, Infant, and Children. SNAP or food stamps means Supplemental Nutrition Assistance Program. And FEMA is Federal Emergency Management Agency. And also, just for the reference, 1 million equals 10 lakhs. So what is food insecurity? It's when someone doesn't have enough food to lead a healthy life, either for themselves or not being able to provide enough food for their family members. It's a very surprising fact that 1 in 9 people are struggling with hunger in US currently. And that number has definitely increased over the last 7 months since the start of pandemic. Let's see food security in numbers. This slide shows that in 2019, we had about 37.2 million Americans who were food insecure. And this number has drastically increased by additional 17.4 million, bringing a total number to 54.3 million in total. This number shows that 1 in every 6 people are experiencing some form of food insecurity in US currently. You'll also notice that compared to white or Caucasian Americans, minorities or immigrants face much more food insecurity. And this could be a result of migration or the lack of resources and opportunities provided to them compared to the white Americans. And most white Americans tend to be in good jobs, whereas minorities tend to be in low-income jobs, which were greatly affected during pandemic. Lockdown in companies meant that someone in a good job with a computer is able to work from home, but someone working in a grocery store or labor jobs or without work before, they cannot work from home, and they do not have computers to work from home, and their job doesn't allow them to do so. And this would mean like construction workers, or even for that matter, our maids, they couldn't work at all. And this led to more insecurity. So what are safety net programs? Safety net programs are various welfare programs. They were developed in US a long time ago. This is to help and protect low-income populations. And these programs are also designed to catch up with populations who are either middle income or better off than poor people. These programs provide free benefits in terms of like free debit cards or various other resources and who are income eligible, as long as they meet the criteria or come below poverty line, they are eligible for these programs. These are the list of programs that are usually offered in US. Though the list is very long for the time management, today we are going to deal with only few of the programs that are offered for poor people in terms of like their food. There are 13 major welfare programs. And let's begin with SNAP, also called as Food Stamp Program. This program provides a debit card that is loaded with money, and the money they receive, it depends on the size of their family. These SNAP cards look like debit cards, and they can be used in any grocery stores, and people are allowed to buy any groceries, meats, fruits, and vegetables. Anything related to food is allowed with this card. And Child Nutrition Program. This program is basically for the school-aged children. This program provides free breakfast and lunch for all the school-aged children who are income eligible. And WIC program. I've been working in this program for the past 16 years. This program is basically for people who are working in low-income jobs but need some help to feed their families. So how did pandemic modify these programs to meet our needs? US government acted very quickly to modify these programs as soon as the pandemic hit. They adopted various waivers and requirements to accommodate the current situations. Let's take Child Nutrition Program. Out of 30 million school children, almost 22 million students either receive free or reduced lunches in their schools. Once the pandemic hit, all the schools went remote. So there was a huge chance that these children would forgo lunch or breakfast, and they would be hungry. Schools started offering bags of foods to be picked up at schools. And for convenience, schools started offering a whole week's worth of food, so the parents didn't have to make multiple trips to the school to pick up the foods. The program also offers lunches during summer vacation when schools are closed, and this is called Summer Feeding Program. And this program has always been available for school children during summer. And School Meals Program also started taking food boxes to the neighborhoods for people who do not have transportation. In some areas, government declared that all school children, regardless of income, will receive free food for the duration of pandemic, thereby making sure children do not go hungry because the schools are remote. What did pandemic EBT do? This was to provide an EBT card based on the debit card, and this can be used at any grocery stores, and it's provided to all the school-aged children, and it's about $28 per week per child. And this is temporary, just for the duration of the pandemic. So this makes it easier for the parents to go to groceries and buy the foods if they are not able to come pick up the foods during school time. And SNAP, or the food stamps program. This makes it easier for people to buy foods at the groceries. And it, just like I mentioned before, it's like a debit card. And the money is loaded onto the card every month. And the maximum benefit a family can receive is about $550 per month. So how did this program adapt to the pandemic? This program during the pandemic period increased the benefits for all the family members, and also it waived the necessity for the people to go to the programs to sign up for these benefits. The physical presence is not required anymore, and the paperwork to sign up can all be done virtually now, either by phone or text. And the next slide is, what is WIC? WIC program serves women, infant, and children up to 5 years old. Pregnant moms and postpartum moms are eligible for this program. And WIC provides free food, nutrition education, and also provides referrals to the healthcare providers as needed. Almost 6.9 million participants are involved in this program every year. WIC program has nutritionists who help women and children who are at nutritional risks. Nutritionists monitor the client's height and weight and check for their hemoglobins when they visit the clinics. And they provide adequate nutrition education as needed. And nutritionists also provide referrals to the doctors as needed. How does it help? It gives the families bread, milk, cheese, rice, pasta, eggs, juice, and formulas for infants until they turn 1 year old. How did WIC adapt to the pandemic? People who were enrolled in this program were required to come into the clinics physically and bring their children to do their height and monitor their weight and monitor their nutritional risk factors. However, during the pandemic, government has waived this requirement for them to be physically present. So the clients can phone in their information and send all the information via text or emails. And nutritionists are doing telehealth appointments to provide nutrition counseling if they are using Zoom or other apps to monitor the health during this season. So next program we are going to be looking at is Older Americans Act. This program is for seniors over 60 years old. Meals are delivered to their homes. And unfortunately, a lot of seniors in US live separately from their family members or far away from their family members. And they live independently on their own. And sometimes they're not able to take care of themselves or cook for themselves. And the program, the Older American Act program, distributes meals to their families, to the house. And this might be the only meal they might actually have for the entire day. And there is an innovative program that started up in California. This is very innovative because, as we all know, all the restaurants are shut down during the lockdown, and restaurants were going broke. So California wanted to integrate both the restaurants and help the seniors at the same time. And they came up with this program using the public assistance. The restaurants prepare the meals and they deliver to the seniors over 65 years old. And the grant money was provided to the restaurants to implement this. And FEMA also declared that taking care of the senior population is a first priority during pandemic. Helping vulnerable adult populations over 65 comes under FEMA, and it provided grants to the local governments to help adults with health conditions. FEMA usually takes over anytime there is like a drastic situations or calamities occurring in US, whether it be floods, hurricanes, or right now with the fires in California happening during pandemic period. We have been noticing that almost all food banks are seeing increased demand for food assistance since the beginning of March. And this might be true just not in US, but all over in all the countries. There is not many donations being made to the food banks, and this is affecting people who are in need. Schools and universities usually donate their surplus foods from cafeteria leftovers, and closing of schools have lowered the supplies to food banks. People flocking to the grocery stores during the lockdown has limited the amount of foods that can be donated to the food banks as well. And farmers, on the other hand, are left with a surplus of crops due to the closing of restaurants, and farmers did not have anyone to pick their crops during the lockdown season either. And this has resulted in a lot of wastage of crops, and they were accounted for millions of pounds of wastage. So what did USDA do? USDA worked with local food distributors to purchase the crops from the farmers. And they also bought dairy products like milk and cheese and used them to distribute to families in need in the form of food boxes. These boxes were distributed to regional food banks where they were redistributed to the population who are in need. And this happened at the local level. You can see in this picture where the food boxes are delivered to local food pantries, churches, and food banks. And you will notice that in each box, they had milk, cheese, grains, bread, eggs, and some kind of produce like fruits and vegetables. And these boxes were handed out to the people. This slide actually depicts how this program, food box program, developed during the pandemic, from the farmers to the distributors and ultimately reaching the families who are in need. So how does pandemic affect us personally? It has affected each and every one of us in some form or fashion. This is especially true for populations who are already struggling with poverty. It has pushed us over the edge and made us choose between food or paying electric bill. It has made us choose between taking care of a medical bill or to eat for that day. It has made us choose between buying food or paying the rent for that month. People are left with no choice but to borrow from family or friends or sell something in order to eat in most of the populations. This picture shows how cars are waiting in line to receive their food boxes. And this is a food bank located in New Jersey. Sometimes these food lines were as long as 3 miles just to get some help to feed their families for that day. Once the pandemic hit, there were a lot of initiatives that were taking place at various levels, international level, national level, and local level. Pandemic mobilized help at all these levels, while WHO, UN, and FAO concentrated more on developing and underdeveloped countries. All the developed countries modified their national and local programs to add more benefits to their populations and released extra grants to help them. This is another food distribution picture that shows locally how food banks or churches started helping out the people in need. International organizations fighting at food insecurity, FAO, WHO, World Bank, Group and USDA are some of the major international organizations who jumped into action to help the countries in need. UN estimated that more than 265 million could be facing insecurities by the end of year 2020 due to pandemic in India, and that is a huge number. Food security hotspots. This map, you can see that continents like Asia, Latin America, Central America, and Africa, which are already food insecure, and the present crisis plunged them further down. These countries are also very ill-equipped to handle natural calamities like floods, droughts, and hurricanes, etc. All these factors make it hard for organizations to even reach them sometimes, since they're all located in remote areas. How about in India? India acted very quickly in terms of lockdown and started helping the poor in need. One of the first groups that were mobilized to help high-risk families in rural areas were women's groups that work under National Rural Livelihoods Mission financed by World Bank. This women's group started collecting masks and hand sanitizers right away, and they also ran community kitchens to provide free meals. These groups helped almost 62 million people all over India. And World Bank COVID-19 package invested in veterinary services, monitoring health statuses, and food security during the current pandemic. According to FAO, about 190 million people are undernourished and experience food insecurity. And about 25% of children go hungry on any given day. When COVID hit India, Kerala was one of the first states to take immediate measure to reduce hunger. Kerala started issuing free rations and food kits, established community kitchens, and used Anganwadi centers to distribute free meals to all children below 6 years. All states adapted Kerala model right away and started their own initiatives pretty soon after with the modifications. And how about local and private sectors? The FRL produced ready-to-eat meals. And another great initiative we noticed all across India, especially with the techies, who started pooling up money right away and collected resources and distributed almost 1 million meals a day. We have also noticed private sectors like Wipro and SRK and many other companies that are not mentioned here coming forward to sponsor meals for people every single day. This is one of the pictures showing providing meals while maintaining social distance. I wanted to mention something about Maslow's hierarchy of needs. If you all remember, we studied Maslow's hierarchy growing up. However, I did not realize the importance of this pyramid until I was much older. We have to meet our physiological needs like food, shelter, water, and safety in order for us to aim for something higher in our lives. How are we going to think about academics or achieving something when we are really hungry? For any country to be economically successful, basic needs like food, water, and shelter are the first steps that need to be taken care of. Safety net programs established in developed countries is a fine example of how they achieved this status and were very successful. We need to take care of our population who is under poverty line. This is the first step for any country to be successful. And then let's come to adverse effects on health of food insecurity. Not having enough to eat every day has many adverse effects on both physical and mental health. It leads to malnutrition and nutritional deficiencies. It is also linked to obesity in countries like US. It is surprising to link food insecurity with overweight, But in US, it is easier and cheaper to get a lot of unhealthy food, junk foods, or fast foods for a very lower price compared to buying fruits and vegetables. So people with limited income tend to buy cheaper and unhealthier foods to stretch their money, which reduces them to not eating healthy. And how does poverty affect us? Poverty takes a toll on both physically and mentally. You can see the list of effects on poverty. Physical effects: suboptimal diets, mild to severe malnutrition, poor health, lower academic achievements, possible role in increasing overweight and obesity, like I mentioned before, poor quality of life, chronic and acute diseases. How about mental effects? Behavioral problems in children and sometimes going into adulthood, anxiety, mood disorders, depression, substance abuse problems, lack of concentration and suicidal ideations, and lower cognitive functions. How many times have we heard about suicide of farmers, or about someone who's not able to provide for them, their families, taking their own lives? You also have to note that there might be so many middle-income populations in India who might be embarrassed or ashamed to let others know if they are food insecure. They might not want to let their family and friends know about their situation, and this leads to stress in the families in terms of their relationships within their family and their relationships within the community. So in conclusion, what did we learn from COVID-19 pandemic so far? We realized that there is a huge gap between rich and poor. It has also showed us how everyone came together to help mobilize programs, starting from international organizations to local level techies sponsoring meals. And they did very quickly. What could solve food insecurities is to continue to do exactly what we are doing now. Like Maslow's hierarchy, the bottom step consisting of food, water, and shelter need to be taken care of all the time, just not during crises, for us to be successful. I will end this webinar with a few last words. We all can be a part of this solution. We can collect non-perishables. We can help serve the cooked meals or help in any other way within our means. Just like what Swami said, Manava Seve, Madhava Seva. Sai Ram. Thank you again for giving me this opportunity, and have a good rest of the conference. Sai Ram.
Thank you, Manjula. It is surprising to know or imagine that developed countries like US and UK also face food insecurity or hunger. Like every 1 in 6 in US are experience food insecurity, which is similar to developing countries like India. You have given us the factual insights of food insecurity during this pandemic. You also have done an excellent job of highlighting the safety net programs that are offered for poor in terms of food, like SNAP program or food stamp program or child nutrition program or WIC program or modification of these programs during this pandemic period. Something interesting is this pandemic EBT cards, which are given to children to prevent hunger, which is also something interesting and aspirational for us. And the awareness of WIC and adaptation to pandemic are also very informative. Then we also gained insights about that match and demand during pandemic and the activities of USDA giving access to healthy diets. And the overview of these activities which are carried out by WHO, UNICEF or World Food Program. So this also has given us a lot of information. And the response of our country to the food insecurity is something which we all felt proud. The initiatives taken by our local and private sectors like WIPRO, and I just wanted to tell you, even our Satisai organization also has come up to help the people, poor people, as a seva during this pandemic period. So I just have a few questions to be asked, which are from the participants. One question is, Manjula, please elaborate on summer feeding programs and how they are different from India.
So I am not sure about the feeding programs in India, but in US, like I mentioned, there is a lot of population under poverty line. And if children do not go to school during summer, we actually have a long summer breaks. It's almost 3 months here. And during that period, all these children who get free meals or breakfast, when they go to school, they're left without breakfast or lunch when they're off during the summer break. And that summer break starts for us from June till September. So what happens at that time is the government actually provides grants to the local programs. And any organization can apply for the summer feeding program. Actually, the company I work for also provides it. So children, and then we put out the flyers or bulletin boards where it's set, where it actually tells us which place they can go and get some lunch. So all these children or the parents go to those places where they're offering lunch and then pick up their lunch from June through September. That's how the summer feeding programs are organized. And summer feeding programs also have a separate grant through USDA. So that is set aside every year just for the children who might need some help with their feeding issues.
Can you throw us the light on the nutritive content of these lunch programs?
USDA actually has a criteria. It needs to provide some amount of carbohydrates, of one protein and one dairy and one fruit and vegetable. So it is a set menu and it has to meet a certain nutrient requirements. And it's called a CACFP program. There is a program that actually runs this food. It actually tries to see that like all the lunches that are provided in school will meet all these criteria. So they have to get like a full healthy meal that will meet protein, carbs, fruit and vegetable, and dairy every single day.
Okay. So thank you, Manjula. Hope all our students and the participants have benefited with the messages that you have given. Thank you once again on the behalf of Department of Food and Nutritional Sciences for sharing your views with us. Thank you. Jai Sai Ram.